أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء الكريم وأصحابه أجمعين أما بعد السلام عليكم ورحمة الله وبركاته Jazakumullah khair to everyone joining us from home, both here in Memphis and in the world. We come to you after several months. Our last update was in April, and this update is on behalf of the Memphis Muslim Medical Clinic and the Memphis Islamic Center regarding any sort of news or progress about COVID-19. Since we last met, we've had an exponential rise in the number of cases. And suffice it to say that this has certainly been an alarming trend. In the past 24 hours, we've had over 180,000 cases in the United States and over 4,400 deaths. In Tennessee alone, in the past 24 hours, we've had over 4,500 cases in the state. And in Memphis, in Shelby County, we've had over 500 new cases. So these numbers are unprecedented. They're more than what we saw in the last surge that peaked in July of this year. The total case count in the United States is about 12.2 million and climbing. And we've had over 250,000 people die from COVID-19. 250,000 people. To put that into perspective, that's about 25% of this population of the city of Memphis. Worldwide, we've had over 55 million cases and 1.3 million deaths. So it's especially important that we take into account the rapid changes that we're seeing and we prepare ourselves. And to this end, we have two specialists here who will speak to us about these measures. And then inshallah, we'll take your questions online on YouTube and during the question and answer link that you can find on the YouTube page. For me, I'm Shan Khan. I am a nephrologist, a kidney specialist, and I'm doing palliative care medicine now. And I'll be introducing to you Dr. Imad Omer, who's an infectious disease specialist at Baptist Healthcare in Memphis, and who's been kind of in the thick of the COVID-19 pandemic and fight. The second speaker is going to be Dr. Muhammad Zaman, who is a professor of medicine at the University of Tennessee Health Science Center, and who is chief of pulmonary, critical care, and sleep medicine at the VA Medical Center in Memphis. And he's also been deeply involved with caring for COVID-19 patients. We're going to first hear from Dr. Zaman. We're going to hear first from Dr. Omer, and then from Dr. Zaman, and then we will take your questions. So, Dr. Omer.
Assalamu alaikum. I want to thank the MIC and also Dr. Zaman for asking me just to participate. Inshallah, I will try to keep my comments brief, and hopefully in the question and answer, you guys can ask whatever you would like. I think Shan has done a good job of going over the epidemiology, the burden of this disease worldwide and also locally. And there are several parts of this that are very alarming to those of us that are taking care of patients with COVID-19. One is that, in spite of knowing about this illness for a very long time now, since really March, we've been having cases, we are still seeing a big rise in the number of cases. In the hospital, we are seeing people that are, taking unnecessary chances. Locally, the health department is responding to this, and we are all having to respond to this. And it is a serious thing. Sometimes when you are dealing with something like this for so long, the natural tendency is to become somewhat lax, somewhat tired. We are all anxious to be with our family. I have not seen my own mother recently, and I know many of you have been separated from family because of this. So it is very important for us to remain vigilant. I just want to go over some of the numbers that Shan had mentioned, and I'm just going to show a few short slides, and then I want to make just a few comments, and we'll turn it over then to Dr. Zaman. So I'm going to try to share my slides here. You should be able to see the slides. Can you see them, Sean?
No, it's not up yet.
Can you see that?
We can see your slide now.
So this just indicates,
Yes, we can see you.
this just indicates what Sean was discussing, the number of cases globally and the number of deaths, and then how the US is doing. This is outdated by just a few days, and already we have an increase over 12 million cases in the United States. Just to look, the United States is the green line here, and you can see that the United States is leading the world, unfortunately, in COVID cases, and we are rapidly moved ahead of every other country, including Brazil and India, which were also having difficulty. But just to make it more local, we've had in Shelby County now over 45,000 confirmed cases of COVID-19. And unfortunately, 600 of our local residents have died from this. But the important thing I want to point out is at the bottom of the slide, the number of new cases. So on a weekly basis, 3 weeks ago, we had only had 2,369 new cases. 1 week ago, that was up to 3,800, over 3,800 cases, and now we're up to 4,400 cases. So this reflects a trend locally and nationally. As Sean said earlier, more than 12 million cases have happened in the United States, but the 2-week trend in the United States is there's been a 55% increase in cases. And that is scary. Locally, we've seen the same thing. The number of cases have exponentially increased. This is how long it takes to reach 1 million cases. For the first 1 million cases, it took almost 100 days, took 98 days. And the time required to reach the next 1 million was shorter and shorter and shorter. And now we've reached the point, a crisis point really, where 1 million cases only happen in 6 days. And there's an important principle behind this. So back in May of this year, the CDC and the NIH and experts said that for communities, when the positivity rate was 10% or more, that was critical. And the reason for that is this, that when you reach a certain amount of cases in the community, when there's a certain burden of disease, there will be people who have the illness and you will not be aware of it. So if you are in a gathering, even with people who appear to be healthy, you may be getting exposed to the virus. That's why this number of time required has gotten so low, because we have so much disease out there now. This combined with really 3 other things make this a very serious situation for us. Number one, what we mentioned, that there's so many cases out there already. Number two, there is the issue of separating, and we've gotten all tired of being away from our family, etc. I think people are gathering now, and that makes it difficult. In the spring and earlier in the year, the weather was nice. We were able to do things outside, but now people will gather inside. And we've seen with every school holiday and every sort of holiday in the country that the cases go up. And so now we are coming up on a time where the kids will be off school, where people will be off from their jobs, and there will be a tendency to gather. And so those things combined together make it very dangerous. So just the health department has issued guidance about, once again, a health order. And so they have said that you have to decrease the number of people that are in public places and restaurants, etc. But also, you have to wear masks, etc. And that's based on how the transmission happens. So we just need to go over that one more time. The biggest way that people transmit this infection is when they are coughing or sneezing or simply talking. So if you are around anyone, you need to wear a mask. Either a cloth mask or one of these disposable masks are sufficient to help. And try to keep a distance of really 6 feet or more. Try to wash your hands frequently. And obviously healthcare workers have more stringent things that they need to do. We particularly need to be careful because there are people that have to care for our elderly folks. And in our community, we often have our elders living with us. So I think those are all issues that are really important. You have to be careful now that we're getting into a time where we're going to be in very small and confined spaces. So I think those are the main points that I wanted to make. And certainly I will be able to take a lot of questions later if you have questions about how the illness is transmitted, etc. I would just point out one thing, that early on in the illness, people were very concerned about surfaces and things like that. And while those may be important, the most important thing you can do is to make sure that you are wearing a mask and you are keeping distant. And gatherings, certainly large gatherings, but even small gatherings where you take your mask off, you put yourself and you put others at risk. And just understand that the virus can be transmitted and is efficiently transmitted before you develop symptoms. You don't have to be sick. I'll just give you two anecdotes, two cases of people that I've seen in the hospital where this is demonstrated. I've kind of changed some of the details to protect people's privacy, but so one case was a young couple were trying to get married, and they had to delay their wedding. And so as a result of that, they decided to get together, the two families, both sets of parents and the couple and the sister. So about 8 people. And none of them were ill, and they took all kinds of precautions. And the father-in-law of the girl developed symptoms on the day they were together after they met. After they met, he noticed he couldn't smell. And the next day was diagnosed with COVID-19. Unfortunately, of those 8 people, 5 of them became infected with COVID-19. And very sadly, one of the fathers, the father of the prospective bride, she died. I mean, he died. So, very sad case, but these are the kind of things that I'm seeing very commonly now. It's not just one person ill, but it is my father is ill, my wife is ill, my son is ill. When patients are coming in, we're seeing lots of people. So just those are the points that I wanted to make, and then I will turn it over, and I'm happy to take questions later about anything that I've said or any other questions there are.
Jazakallah khair, Dr. Omer. We will now move to Dr. Zaman, inshallah.
Bismillah, alhamdulillah, salatu wassalamu ala Rasulullah. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, I want to thank Brother Imad, very, very busy practitioner. One time he said he has 85 days of continuous work without a break. And he has small children and family. So may Allah reward him for this time and for this presentation, sharing his expertise. And also to Shan and Brother Light and everyone in MIC and Memphis Muslim Clinic for this opportunity. I would go and share with you an experience this morning as I was entering the hospital for my on-call and approaching the elevator. I saw this scene here. You see a patient on partial life support, on oxygen, and there are 2 healthcare workers. So as I approached the elevator, the health worker said, Assalamu alaikum, Dr. Zaman. So I said, now I know This is Sister Asia, our respiratory therapist, transporting. She is the one with the head mask, head cover with the pulp, and she's on the left, and the nurse is on the right side. So just to acknowledge that healthcare workers across the span in this city from the Muslim community and beyond are serving a life-threatening illness, risking their life. The level of stress, the level of anxiety they bring to work and they bring back home when they go home. They don't share space with their children, family, like most of us do. They kind of partially isolate themselves in a separate space, and their life has been compromised for 8 long months. So this individual, as we see here, of course, I will not identify him except to say that he's 61-year-old, and he presented early this morning with this X-ray on the right side. And those of you who have a little knowledge, you will see on the left side his prior chest X-ray. This is a clear chest X-ray with no pneumonia. On the right side, you see these densities marking the cloudy appearance, right lung and left lung, the heart is in the middle. This is COVID pneumonia. He has been given oxygen and he had a CT scan done in the emergency room. It shows this pneumonia has involved the top, the middle, and the lower part of his right lung, as well as the left lung. And as you go to the back of the chest, towards the back, you see more of this, what we call consolidation or pneumonia. This is the most lethal manifestation and the most common manifestation of COVID disease. Pneumonia from COVID can lead to severe disease, which can then lead to critical disease, and patient then become dependent on life support if that is available. Think about the rest of the world. Think about where we come from. Life support is not available. People are suffocating to death. Oxygen supplementation is not available. Our religion is based on mercy and compassion. Mercy is mentioned in Quran 550 times. Allah subhanahu wa ta'ala, Rahman Rahim. So my brothers and sisters, have mercy, have compassion. Think about the suffering and tragedy that is embracing everyone on the globe, Muslims and non-Muslim, and think about what you can do. So the Imad has given you numbers, but he kind of told me, show this slide as well. Here we are looking at ICU census. The dotted line shows 100 patients in ICU that was exceeded in the summer surge. You can see the month of July, August, September, we went up to 120, 130 ICU COVID patients. I'm not talking about all ICU patients. This is more than a third of all ICU capacity. And then we went down in the beginning of fall, and now we are moving to cross the 100 again, and the projections are given with the confidence of 5% and then 20% and 50%. We could, on the upper end of the projection, reach as high as 300 ICU patients, which will completely overwhelm the capacity of the city's ICU capacity. By the Christmas day, December 25, it is expected that the number will increase from about 100 now, or a little less than 100, which is November 16 this past week, to about 125. How about the hospital capacity? The same story. We had the surge in the summer and we fell back in September, October, and we're now climbing back up. And the projection again, depending on the degree of confidence, degree of probability, I should say, 5%, 25%, or 50%. By Christmas Day, December 25, 500 in hospital admission for COVID pneumonia alone, and that number could go up to 1,200. And that number will completely overwhelm the capacity of the hospital system of Metro Memphis. Brothers and sisters, we live in a city of hospitals. Memphis is well known for its state-of-the-art advanced healthcare system, multiple hospital systems. The university-affiliated hospital, the Methodist hospital system, the Baptist hospital system, San Francisco hospital system, all of them will be overwhelmed. So if one of us, Allah forbid, lands in the hospital, an emergency room takes him to intensive care unit or heart, there may be no space, there may be no life support, there may be no critically trained nurses, there may not be critically trained physicians available. So that is my way of telling you, take all the precautions for you and your dear ones. Because what if you end up being ill and progress to develop severe illness, and in your city and in your county, there is no place to provide you the type of support and certainly the critical care support that you need. Here is a slide to show you now the disease that we call SARS-CoV-2. Coronavirus word has become so commonplace, we have forgotten the true name actually is SARS, Severe Acute Respiratory Syndrome from Coronavirus 2. So the severe acute respiratory syndrome is what we're trying to focus here. The virus enters the body, finds a place in the nares or the upper airway or in the lungs, and it starts its phase, and the virus count is gradually decreasing as the time passes by. But the body responds with inflammation, right? And the inflammation keeps escalating from stage 1, when you are relatively asymptomatic, to stage 2, where you may have a slight cough, to stage 3, when you develop shortness of breath and decreased oxygen saturation. Your severity of illness will progress as the stage progresses to an hyperinflammatory phase. The most severe one is called acute respiratory distress syndrome, or ARDS, which is the #1 cause of death from COVID pneumonia. Shown on this pyramidal graph, the base of it is the widest. The susceptible population are 330 million people in this nation, and there is a certain percentage which are not precisely known that are asymptomatic carriers of the virus. We do know that when a person gets exposed to coronavirus disease and the test turns positive, there is a 48-hour plus minus window period when the person may be infective, contagious, can transmit the infection but has no symptom. This perhaps explains the yellow area here, why this disease has been so difficult to tackle, because asymptomatic spread can progress without the spreader or the patient knowing this. Then begins the symptoms, little bit of sore throat, right? Little bit of runny nose, maybe myalgia or fatigue and muscle aches, and then a cough without sputum production, we call it dry cough. And then it can progress to shortness of breath. So as a prototype symptom, shortness of breath begins the process of what I showed you in the patient that I took care this morning of pneumonia. Shortness of breath is the most ominous sign that it is possible, it is probable that the disease can progress to severe pneumonia, severe respiratory failure, requiring life support, and prolonged need for intensive care unit care. And despite all of those and all the treatment progresses, there will be certain percentage of people, as many as 50% of those who land in ICU may not recover and die from the illnesses. And hence you have those numbers that you heard from Brother Imad and Shan as well. I think going back to Brother Imad's presentation, just to show you that today, in the 24-hour period, 430 cases were reported as of 1 p.m. today. And the caseload, as you can see, are going from less than 200 in October to now 400 cases. So we are rising. And to show you the Shelby County surges, spring spike was not very high, but the summer spike was high, but the fall spike is definitely looking higher and maybe the highest of any spikes. So with this as an introduction, we will go back to Shan and begin to field your questions. Inshallah, feel free to ask anything you want. We may be able to answer your question. We may not be able to, but we'll give you the best response we know. And may Allah reward everyone who joined today. May Allah reward everyone who participating today. And also may Allah protect you, your family and dear ones. Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah khair, Dr. Zaman and Dr. Omer, for your very concise and informative thoughts. Inshallah, we'll proceed on to the question and answers. And remember, you can ask questions in the live chat on YouTube or follow the link on the live chat in YouTube as well and submit your questions there. We've already got several questions that people have submitted. And the first question, I guess, that we can ask is, what are some precautions to take when going outside besides wearing a mask? And I'll give that one to Dr. Zaman.
About precautions supposed to be by the Imad Omer's issue. Okay, but the Imad, take that one.
Okay, so if I understand the question, it is what precautions to take when going out. So the good news is that being outdoors and being in open environments is much safer than being indoors, or especially being indoors in areas that are not well ventilated. So if you are going out in the park and you have your no one else around you, you don't have to wear a mask. You can walk outdoors and you don't have to take extra precautions. But if you are in a gathering, if you are in a group of people, then you have to take those same precautions. You have to wear a mask. You have to try to keep a distance of 6 feet or more. There are two things that can impact your risk. One is the amount of time you are exposed, and the other is the exposure. So if you are sitting in a well-ventilated room for only a few minutes, your risk is less than if you are sitting in a room, a closed room that doesn't have good ventilation for a long time. And if you look at the guidance that has come from the health department and other places, it reflects that. For instance, for restaurants, they are not supposed to serve beyond a certain amount of time, because the longer you stay in a closed place, the bigger the risk is for you. So if you're going out and you're going to restaurants and such, that is a risky thing. And it's the reason that the guidance has come out about that, because when you're eating, you have your mask off. There are some places that are going to be better than others in terms of the way they have things spaced and the way they are ventilated. It's very hard to comment on specific places. So if I understood the question right, hopefully that answered it.
Shan, you're muted. Shan, you're muted.
Can you hear me now?
Yes.
Okay, so that was a pretty thorough answer. I think that answered the question, Dr. Omer. There's a follow-up question to that, which is, are there any particular type of masks that are more effective for the general public to wear in terms of cloth masks versus surgical masks?
Brother Omar, go ahead.
So I think there's been a lot of discussion about this, and you can find recommendations for this at a variety of websites, including the health department website, the Shelby County Health Department, in terms of what kind of mask you are supposed to wear, etc. But generally speaking, for the general public, as opposed to healthcare workers, cloth masks are okay. The surgical masks that are fairly readily available are very good to wear. The thing to know about those kind of masks is that they are not something that you use indefinitely. So yes, cloth masks can be used, they can be cleaned and sanitized, etc. But the surgical masks that we use, I sometimes see people wearing those for days and days and days, and for weeks. Those are not to be used for that long. If they ever get wet, then they're not reliable. So that is something also to be aware of, that those masks should be changed frequently. As often as you change your clothes, you should be changing your mask, maybe more often. Generally, that's the way to use those masks. But there's guidance on that Shelby County Health Department site. But for the most part, the idea is to have a covering that fits over your nose and your mouth. And there's a right way and wrong way to wear those. I'm sure you all have seen that sometimes people have a mask, but it is slipped down below their nose, or it is not fitting properly, and that defeats the purpose.
Yes, it's absolutely important to wear your mask correctly, which is like this, covering your nose and your face, not sitting like this, not like this. which we've seen people do that, unfortunately. The next question that we have is, why is the surge happening now? And I think Dr. Omer and Dr. Zaman both kind of answered this already. It's because people are starting to gather more. They're starting to get a little bit lax with the protection recommendations. And Dr. Zaman or Dr. Omer, would either of you like to comment any further on that?
I'll just make one comment about that. Part of the reason that we're seeing the surge now is directly because we took certain precautions in the past and then we let up on those. So there were many places that had ordinances regarding mask wearing that encouraged people to wear masks, and then those were relaxed. And then we also opened up certain things. We opened up, restaurants, and, people were going to different places. And so all those kind of things cumulatively have contributed to the surge. And also the idea that, yes, people are more relaxed, they're gathering, there's this sort of isolation fatigue where people haven't seen family, haven't seen, others, and they're gathering more. Many people put off events that they had, anniversaries and weddings and different things. And then when they got together for those, these things would happen. And so I think as the pandemic has wore on, people have felt that they could no longer wait. And unfortunately, that has resulted in, these kinds of things happening, not just in this country, but all around the world. And so that's part of the reason that the surge is happening now and the way that it is.
Jazakallah khair. There are several good questions on here, so we'll try to get to them all in time, inshallah. One question, I think, Dr. Zaman, for you is, what kind of long-term effects can we expect patients to see who've had COVID-19, and how long would they potentially last? I know that's hard to answer. And how concerned should people be about these?
So good question. Again, the answers, there are things we know and things we don't know. Long term, we don't have long term yet. So let's say we would not know the outcome after 1 year because we have not gone through 1 year of illness and recovery. This is something needs to be known. And larger number of cases has happened, as you saw, Brother Imad's slide, that in the last 3 months or 1 month and last couple of weeks, the cases that are increasing, those sequel or consequences of recovery of different organ will take time to know. So keep that in mind. We would not know the final answer. So I'll give you the following answer. Number one, drawing our experience from other viral pneumonia. Remember, COVID pneumonia is not the only pneumonia we know about. There was chickenpox pneumonia. There was HIV. Of course, it did not cause pneumonia, but cause opportunistic infection. And there are other pneumonias that specialists know, CMV pneumonia, herpes pneumonia, adenovirus pneumonia. Based on those pneumonias, when we followed them 3 months, 6 months, 9 months, and 12 months, most people recovered. Their chest X-ray, their CT scan looked back to normal. If you do finer test of lung function, we call pulmonary function test, like diffusing capacity, you will see some persistent reduction of number in a small subset, 10 to 15% of patients. So the vast majority of viral pneumonia historically has recovered without any sequel in the lung. I would expect the same outcome when we have enough follow-up. As I say, we will need 6 months to 12 months of follow-up. Maybe sometime next year we will have more information. But I do not expect the lung dysfunction to be lasting. The next thing we know, the more severe the illness, I showed you mild illness and then critical illness, severe illness and critical illness. More severe the illness, whether the lung takes the hit or also the heart takes the hit or the kidney takes the hit or the brain takes the hit, longer is the recovery. We know that. People who have mild disease, 2 weeks later, they are back to normal. People who have acute severe disease, they may take 3 to 6 weeks. People who spend life support 3 to 12 weeks in ventilator, they will need 3 months, 6 months, 9 months, maybe 12 months, right? So let's say optimism, most likely most organ dysfunction will recover. I cannot say that for cardiac function, neurologic function, I'm not a neurologist or cardiologist, but for respiratory system, severe disease will take longer. I have many patients that I follow with persistent cough, shortness of breath, on oxygen, 3 months after recovery. So not a small consequence. The consequences are there. More severe the disease, longer the recovery, more severe the consequences. But inshallah, eventually, most survivors should recover most organ function, if not all.
Just add one thing to that. That was an excellent discussion. There was a recent report in the British Medical Journal, and they found that about 10% of COVID survivors had some long-lasting effects. In other words, beyond 3 months. Those tend more to be younger patients between the ages of 30 and 40. There was a slight predominance of women compared to men in that group. We don't have the details about that, but these are effects that are generally somewhat mild, but can affect people, and some people are more affected than others. These can be things like difficulty concentrating, difficulty with some fatigue. And this is not unique to COVID-19. We see this with other illnesses as well, that sometimes people have what we call post-viral asthenia. In other words, after you recover, you're not 100% back to normal. Eventually, over time, it gets better. That's what we hope. As Dr. Zaman indicated, we don't have enough time with this illness to know how people will do in the very long term. But it does appear that there are some people that will have prolonged symptoms, up to 10% of people. And if you think about that, in the United States, that's 1 million people. So, and again, some of these symptoms may be relatively mild, and some of them may be more severe, like Dr. Zaman is talking about, where people, 2 and 3 months after the illness are still on oxygen, or they need to be in a rehabilitation facility, et cetera. It all depends on how severe their illness was.
Thank you.
Jazakallah khair. That's certainly something to be thinking about and pondering upon. There are several questions about vaccinations, about outdoor dining. I think some of this stems from the holiday times that are coming up in the next few weeks and the next month or so. People are going to have time off from their jobs. For those that don't work in the house, and even if you work in the house. So I've got several questions about these. The first question is it safe to go to restaurants with indoor or outdoor seating? And if so, which one? Or is it better to just eat at home? Or if you must get something to eat from a restaurant, to do takeaway? And I will leave that to Doc. I'll leave both of you to choose.
Brother Imad, go ahead.
Right. So I guess every activity that you do, whether it be related to COVID-19 or otherwise, has some risk and benefit, right? So as we indicated earlier, if you are going to a restaurant, that is a risky behavior. Since the COVID pandemic began, I have not eaten inside any restaurant. And I won't be doing that. And one of the reasons that the health department has issued a guidance as of 2 days ago for restaurants to cut their capacity and so forth is because the risk is higher. So if you are taking your family to a restaurant, yeah, the risk is higher, and it all depends on the restaurant in terms of what their ventilation is, et cetera. It also depends on how long you are in that restaurant. But yes, that's a risky behavior. And as the surge goes on, that risk becomes higher, because remember what we said, that the more there are people infected in the community, the more there are people that are asymptomatic. And so somebody may have come to that restaurant and they feel completely fine, but they're shedding virus and you don't know it. So yes, that's a risky thing to do. I would generally say that, eating in restaurants is riskier than doing takeout.
Jazakallah khair. And a follow-up to that question, Is it safe to currently fly or travel, Dr. Omer?
So at this point, we've had more data about flying, particularly on airplane travel. And it turns out that airplane travel, because of the way that air exchanges are performed on airplanes, is not as bad as one would have thought. So that's a good thing. So yes, it is possible to travel safely and to, go on a plane trip. But obviously it's safer not to do so, right? Is there some risk? Of course there is. The airlines are trying to do their best, and some of the destinations are doing their best to make sure that people are screened ahead of time. Some countries that you travel to still have travel restrictions. In other words, if you arrive at certain destinations, you have to be quarantined for 14 days. There are most destinations are requiring people to be tested before they travel. And that provides some, confidence. But again, remember that if you are exposed to somebody with COVID, you may develop symptoms and evidence of infection between 2 and 14 days afterwards, right? So if I go and get exposed to COVID right now and get tested tomorrow, I'll be negative. But on day 3 or 4 or 5 or 12, I may be positive. So that is not a complete assurance being tested. And so also with respect, I know this wasn't your question, but I'm going to segue into this, that with respect to gathering at holidays and things, some people feel that, having been tested assures that you won't become ill, at your family gathering. Well, that's not the case. Even if you tested negative, there is a possibility that you may be harboring the infection.
Yes, and that was going to be part of the next question, which was, we know that the time that you can test positive is 2 to 14 days potentially, exactly like you said. And a negative test doesn't mean that you're not going to get the infection or that you might not test positive later. Some people have been asking, is it okay, I guess two-pronged, is it okay to be with family or to come visit if you're not living in the same household or same city? And is it safe, let's say, for example, for like parents who might work and the kids are at home, for the kids to be with their grandparents?
Brother Imad, you want to take that?
Well, it's a difficult question, but the simple answer to that is no, it's not safe. It is obviously safer to get tested than not get tested, but if you are not living with someone, then there is a possibility that you will carry the virus to them or they can give you the virus. If you've quarantined for 14 days and haven't been around anyone and you test negative, then you're safe, but that is not very practical for most people to do, right? I can't quarantine myself for 14 days, get tested, and then go visit my mother. But if I was going to do so, that would be the safest thing. So that it would be the safest. Obviously, not getting tested, not taking precautions, and then going to visit my family member, that would be the riskiest thing. And then there's everything in between. So, I can't tell you, yes, do this or don't do that. But what I would say is that do not feel 100% confident that you tested negative today, but you were going to work the day before and the day before and the day before that you weren't exposed at some point at work, right? So that is very individualized for everyone. But generally speaking, there is some risk for people, even in your own household, right? Let's say that you are working every day. And there's someone in your household, a mother or father whom you live with, elderly. Well, you're working every day. You could potentially acquire the illness, not know it, and get your family member ill. So I think generally speaking, we should be taking lots of precautions, particularly with people who are elderly and particularly with people who have problems with their immune system.
So Shan, if I can, thank you, Brother Omar. The need to visit parents or grandparents and family dynamics and situation may place a family to visit another family. You already heard Brother Imad said this is not without risk. But if you want to mitigate the risk, reduce the risk, right? Certain things might be useful. So you visit, travel maybe by road or plane, take all the precaution. If you stop at a gas station or a service station, don't touch any surfaces, keep your mask on, take along with you all the snacks and drinks with you, so you don't have to rely on going to multiple stops. And if you could, before departure, keep yourself, if not for 14 days, at least a week without minimizing the contact before the travel could be helpful. Once you arrive, you know, we have been blessed with a mild fall. Those of you who lived in Memphis know that this has been so far a milder fall. We are late November and we have not seen frosting yet, right? So if you're going to travel to southern United States where the temperature is higher, you may be able to arrange a very pressing family visit. Someone you must see, want to see, haven't seen for 8 months, and meet them outdoor, right? You can fulfill the obligation of visiting a family member, particularly parents, and meet them outside. Outdoor is way safer than indoor. That's a general statement applicable to all outdoor situations, unless you sit next to each other, sharing the chair handles, and you are 2 feet, 3 feet away. So sitting outside, such as in a backyard situation, right? And keeping your distance in their gathering. One of the most common problem I see that as soon as you see a family member, your heart is crying to go give that big hug, right? And the mask is out through the window and you're going to go and give your mom or dad or grandma, grandpa a big hug. Avoid that, right? If the longing of the heart is to see the elderly parents, you could go see them, keep the distance, keep the mask, keep outdoor if possible, and you can even share a meal. I would go as far as saying in this part of the country, going further south, you could work on a trip that will reduce the risk and you fulfill the obligation of the trip. Use your knowledge that have been given to us in terms of distancing, masking. When you put the food in the mouth, you have to remove the mask, but you don't have to be 2 feet from another person. You can take your plate and go a 6 feet distance. This can also be true indoor. This could also be true indoor. Sit in dinner in an arrangement of chairs and tables around and not on the dining table. Because once you sit in the dining table, 6 people, 8 people, you're going to be not 6 feet anymore. Do you have to sit in the dining table to eat a dinner? No, in this situation, improvise, distance yourself, go outdoor, use precaution, inshallah, if you have to. That's what I'm going to offer as a practical advice. Thank you.
Jazakallah khair. I do want to move on. There's one more question that I want to ask about this social related things. And there's several questions about potential vaccines, medications, and antibody tests. The kind of the final multi-pronged question that I want to ask is that we've received is grocery shopping is a need, unfortunately, that we all have to do. And with all the sales coming up for the holidays, the question is it safe to go shopping outside for these kinds of sales? This is a tough question, to go shopping for these kinds of sales outside, number one. And number two, somebody also asked, are masks with valves safe to wear? And I think Dr. Omer, this is towards you.
Yeah, so I will take the second part of that question. The masks with valves, are they safe or not? So there's a filter in those valves. It depends on what kind of valve what kind of mask you're talking about specifically. But generally those things are okay. They're not N95 masks. So some people are under the assumption that those are the same as N95 masks, and they are not. So yeah, those kind of things can be used. So that's simple. The harder part of the question is, what about shopping? Well, certainly all of us have to do that, and you just have to take precautions, as Dr. Zaman just mentioned, right? You have to wash your hands, you have to wear a mask, you have to keep distance, and you need to do that wherever you go. So if you are planning on doing shopping and it's in a very small store, but that's doesn't have a lot of space, and there are people crowded in there, one, that's violating the county recommendation, but number two, it would be riskier than if you go to a big store like, Walmart or Costco or something else, where there's lots of room indoors and you can be distant from people. Most of the stores are being pretty diligent about making sure that people wear masks, about having plexiglass where the people that the checkout clerks are, etc. So yes, I think it is possible to do that. Other things are also possible. You can call ahead and order your groceries online and then pick them up. Those kind of things can be done as well if you want to minimize your exposure. Some people are worried about the surfaces, right? They get the groceries delivered and they're like, well, wait a minute, can I touch this now because someone else has brought it to me? So we think that that kind of transmission is certainly less efficient, but again, same thing applies. Wash your hands, and be careful before when you're handling food, etc. That's generally a good thing, but it's also true with respect to COVID-19.
Shan,
Jazakallah khair. Yes, the masks, like you said, the valve masks, you have to be careful. The industrial construction masks, they're not designed to protect. They don't protect you from COVID-19, like Dr. Omer was saying.
Shan, can I go back on the mask a little bit? I know you're going to.
Yes, just really quickly, Dr. Zaman, please.
Another subject. So very quickly, let's say that any mask is better than no mask, right? And the notion that mask is for you to protect others from you being infected is not true. Mask works both ways. You protect yourself and others are protected from yourself. As simple as a cloth mask can filter 50% of the viruses, and in some cases up to 75%. So if somebody is infected and you have a simple cloth mask and that person coughed and sneezes, remember, the particles are not the viruses. If I told you how many virus particles make a pinhead, what would you say? How many RNA virus fragment will make a pinhead? Pinhead is a tiny head, 100 million. 100 million virus makes a pinhead size. It takes 150,000 magnification to see this thing in electron microscopy. Is that the drops we expel when we sneeze and cough? No. Most of the particles are way larger, right? So these things are captured by the mask. Even cloth mask will capture particles that are 1 millimeter size in diameter or 1/10 of a millimeter in size. So most of the expelled viruses are not individual viruses. I just gave you the number. They are larger particle droplets. Larger droplets are captured, at least half of them, up to 3/4 of them by even simple cloth mask. To conclude, please do not belittle mask wearing. Use them and make sure you have them cleaned, as we said, but please don't be too smart to say it's not American to wear the mask. If you do that, you do it at your own risk.
Just one more comment, and I totally agree with everything you just said. With respect to the masks, so the masks do two things, right? Number one, they protect the wearer, right? So if you wear a mask, that protects you. That's less efficient than the other way around, and that is that if you wear a mask, you are protecting those around you. So the valve mask does one, but doesn't do the other very well, right? So the valve mask will protect you just like a cloth mask, but it won't protect anyone you're around. So if you have COVID, you might be more likely to spread it if you're wearing a valved mask. So that's one of the reasons that those have been but if that's the only thing you got, it's better than no mask. But I would say that if you go to the websites of the Shelby County Health Department or the CDC, they will indicate to you, what should and should not be worn. And so that's an easy thing to do. but just a simple cloth mask or a surgical mask, probably the best way to go. Some people feel that they need to get an N95 mask. Honestly, that needs to be healthcare workers who are test fitted. Those masks aren't any better than a regular mask if they are not specifically fitted to you.
Excellent.
Yes, that's very succinct. Jazakallah khair. And one thing comes to mind regarding masks, and I think this sums it up pretty succinctly. There is a hadith that we all have probably heard, which says, you do not truly have iman unless your neighbor is safe from your mischief. So it's important to keep in mind that you're not only trying to preserve your life, you're trying to help save potentially the lives of your fellow human beings along with you. I guess I'll add one more question before we get on to the vaccines. And I know we're running short on time. Is people exercise outdoors and sometimes they go in groups, like they like to walk. Is it safer to wear masks while walking together, for example, or running together, or not to do that? I guess Dr. Imad.
Right. So any activity you're doing where you are breathing more, you are exhaling and inhaling more, and so that increases things. So if yes, you should wear a mask when doing those things if possible. I guess if you are around your family, you're going to be in the house with them, then it's reasonable to be outside with them doing that as well. But what I would say is that the more heavily you are breathing, the more forceful your inhalation and exhalation is, the more virus you would be expected to inhale and exhale. So I think generally it's a good idea if you're doing that to try, but in outdoor spaces, remember, it's easier. So if you're in an outdoor area where there's no one else there, you don't have to wear a mask. If you're going out jogging, then you don't have to wear a mask. Now, if you're jogging on an indoor track with, not very many people there, then that's a different issue. There's still going to be ventilation issues, etc. But if you're outdoors, I don't think you necessarily have to wear a mask. Any activity that you're doing where you're inhaling or exhaling, so going to the gym, right? That is probably one of the riskier things that you're going to be doing because you're doing physical activity where you're inhaling and exhaling, and if the ventilation is not that great, then it's a riskier proposition.
Jazakallah khair. I think we'll go for 10 to 15 more minutes, and then we'll need to stop.
Shan, one part of your question was group exercises. So just distance from each other, right? If you go to group outdoor activity, you can't keep the mask. You're breathing so hard, you cannot keep the mask. Just distance from each other. Thank you.
Right, like exactly what Dr. Zaman said. If you're biking, for example,
right,
spread out if you can. Obviously avoid cars, but spread out if you can. That's just an example. So moving on, I'll say we have 10 to 15 more minutes, inshallah. And the main questions are regarding the vaccine. We have recently heard within the past week that there are 2 promising candidates coming out in the United States for vaccines. One is from Pfizer, one is from Moderna. And they have reportedly close to 95% efficacy in their early test results. So the questions that people have are centered around these. One is, how can we trust a vaccine that's been prepared so quickly, and how will it help, number one? And number two, there are some examples of the virus mutating in Europe that have been seen, and how will the vaccine potentially be affected by that? Dr. Omer, I believe, first.
Okay, so we could probably spend several hours discussing vaccines, and we probably wouldn't get to all we have to discuss. So one thing that's new and exciting, alhamdulillah, this is a new technology. These vaccines are what we call mRNA vaccines, and so they're different than the traditional vaccines that you're used to. And the science behind vaccines has changed over time, and so now we're able to do some things that we weren't able to do before. And both of these vaccines from Pfizer and from Moderna are mRNA vaccines. So that the production of those is easier and faster than other types of vaccines. For instance, the flu vaccine, right? It takes a great deal of time to generate a flu vaccine. And there's a timetable. I actually have a slide about that, but I'm going to leave it out. I'll just say that it takes a very long time to generate a traditional vaccine because you have to grow the vaccine, you have to find a way to deliver the vaccine, and the production of it takes a great deal of time. The other thing about vaccines is that a vaccine, for instance, against a bacterial infection, sometimes what you do is you take a piece of the bacteria, or you take some protein, a purified protein that is in the whatever the illness you're trying to vaccinate against, either virus or bacterial, and the body reacts to that and forms an antibody, and then that antibody gives you protection, right? So there are several steps to that, and they're very complex, and maybe not get into it here, but it is the reason that you get some symptoms, and the reason that those vaccines take some time. And they also explain why you get certain side effects, right? So these mRNA vaccines actually give the recipe to the body to make the antibody against the thing that we're trying to infect, right? That's trying to infect us. So that's what's done. And when vaccines are made with respect to this idea of mutation and different strains of the vaccine, that's one of the things that is done is you try to find something that the virus keeps the same, that it doesn't mutate, so that the vaccine is not affected by mutation. And different illnesses have different rates of mutation, and they have different parts of them that mutate. So these vaccines that are coming out have to do with the part of the virus that attaches to the cell, something known as the spike protein. But there are many, many, many different candidate vaccines. But part of the reason that this vaccine is able to be generated faster is a new technology. The other thing is that an important thing to understand about not just vaccines, but medications, there is a process that has to be gone through to ensure their safety. And the FDA has sort of mandated that in this country. In other countries, it's similar. So there's a phase 1 study, there's a phase 2 study, and there's a phase 3 study. And you have to go through those, and you have to meet all the requirements for that before anything is approved. And that's the safety measure. So it sometimes takes a very long time to do some of those studies. And sometimes it doesn't take a very long time, depending on how many people have the illness, for instance, right? So these type of studies are being done. So what you have heard about are the phase 3 studies for these 2 vaccines that are coming out. The first 2 are finding the right dose and then safety. And then the phase 3 is effectiveness, but also safety and side effects because you have more people. So these were done in many thousands of patients to study effectiveness. And that's what you've heard in the news. Part of the reason these vaccines are so effective is that they basically give the body the information it needs to make that antibody. So we don't rely so much, for instance, old people sometimes, when you vaccinate them, if their immune system is weak, they don't get a response. And that's because there's a lot of steps that are required for them to do that with the traditional vaccines. And we're bypassing some of those with these newer vaccines. So there's a very long, I think, discussion we could have about vaccines, but I hope that answered the questions. If it didn't, I'm happy to clarify.
Yes, Jazakallah khair, I believe that did. And there's a follow-up question that somebody asked specifically for you, Dr. Omer, and it's about potential treatments, medical treatments, not vaccines, for COVID-19. Do they exist? And if so, are they effective?
Right. So we do have some medications that we are using right now to treat COVID-19 in people who are infected. The 2 main ones that we use in the hospital, there is an antiviral medication known as remdesivir. and it appears to treat the illness. So when Dr. Zaman showed you that slide that showed two different phases of the illness, right? The first was the phase of the infection of the virus, and the second phase was the phase where the body is fighting the virus. So this medication is important in the first phase. Unfortunately, we haven't had much of that medication until recently. And so the studies that were originally done were done in people that had had the illness for a long time or who are severely ill. It may be that we find that these type of medications are used more effectively early, but that is one of the medications we have, and it's in the first phase that it becomes important. The other medication that we have is dexamethasone, which is a steroid, and that was studied in a very large trial in Europe where we had, maybe 9,000 people that got it. And that study showed that in people who were on oxygen, they got benefit from that medication. And so that is something to use. It is not something that we use in people at home that aren't on oxygen from this illness. It is not something we use even in people in the hospital who are not on oxygen, because in the study of many thousands of patients, it did not show benefit in people who were not severely ill or who were not on oxygen. In fact, maybe it certainly didn't help, and it's possible it could harm. And so for that reason, we don't use steroids. So those are two medications. The other thing that you may have heard about where the data are not as clear, but that we still use and are using that can help early on in the illness, probably doesn't help later, is something called convalescent plasma. So that is where you take the plasma or the blood of somebody who has already recovered from the virus, and you can give it to somebody who is now ill and their body hasn't had time to make the antibodies. So those are the three main medications that can be used. There are some newer things that are coming out, you may have heard about in the news. They're not widely available. There was a new drug that is available recently as an expanded use. It's going to be very limited. It's going to be very severely ill people, and we don't have all the information about it already. There are some things that were tried that were not effective and should not be given. I have seen still in the community, people are giving antibiotics for this infection, and they are not effective. So giving zithromycin is not effective for this illness. We do not give hydroxychloroquine for this illness. That was done early on because of some information we thought it might help. And then several large studies were done that answered the question. It does not help. And in fact, in many people may cause harm. And so we don't do that. So that's where we are in terms of medications. In addition to that, there is now a monoclonal antibody that is not widely available. We have very few doses of that we received, and some people can get that. That is only for people to get before they become ill and end up in the hospital. It is for outpatients only, and it's for outpatients who have certain risks based on their age and underlying health problems.
Yes, good, excellent, Brother Imad Shan. Just to let everybody know, Memphis was the leader in developing steroid for inflammation in the lung, right? My colleague, Dr. Meduri, and we have been working for 30 years to establish the rule of what Brother Imad said, dexamethasone is just one type of steroid. You all know about cortisone. You all know about prednisone. You all know about Madrol dose pack, right? Methylprednisolone. These are various types of steroids. They will achieve equivalent effect. So steroid therapy for inflammation in the lung, as you have heard, unless there is inflammation, is not going to help. If the disease is so mild that you don't even need oxygen supplementation, there is not enough inflammation, there is not enough pneumonia. I remember the CT scan I showed you on my patient. If there is not enough inflammation in the lung, 20, 30, 40% of the lung has white out, those cloudy density, that patient may get more harm because steroid is an immunosuppressive agent, right? But the inflammation is what kills the patient. So if you can suppress the inflammation, and you can protect and save life. The only treatment that Brother Imad went over that has shown to save life is steroid therapy. By the way, if you go to the streets of Karachi or Dhaka or Lebanon or any Muslim nation, these medication can be found at the corner pharmacy for pennies, for rupees and takas, very inexpensive because they have been around us. Decadron tablet can be found for American pennies, right? So Allah's blessing here, there is a treatment which can be very cost effective, available to most of the people in the world, and much of the research was done in University of Tennessee, Memphis, in the VA Medical Center in Memphis. It's something to be proud of. So I got to share this with you because that's what we do. That's what we have been doing all these years. Jazakallah khair.
Jazakumullah khair. Yes, that was very thorough. There are two final questions remaining. One question is, and I will ask this for Dr. Zaman, are antibody tests, is it worth it to get antibody tests for the average person?
And that question can go to Brother Imad, but no, the answer is for acute illness, there is no role for antibody testing, right? This is more of a epidemiologic tracking system to know the denominator, what is the infection rate in a community, right? And in some cases, when you have repeated PCR RT test or throat swab test negative, you could consider, but that will not be positive until 2 to 3 weeks from the onset of the illness. So for an acute illness and diagnosis, its role is extremely limited, and I'll not encourage its use. Let's get a few more questions.
So let me just add to that one thing. I think some people feel that if they get an antibody test and their antibody test is positive, then they're safe, then they can go visit their family, then they can do whatever they like because they're not going to get ill. So one thing to understand about the antibody test, it depends on where you're getting the antibody test because there can be some false positives with the antibody test with routine coronaviruses, right? So there are lots of different kinds of coronaviruses and COVID-19 is just one of them. And so that test sometimes is not specific depending on where it's done. So that's number one. The other test that you're talking about, not antibody tests, but the PCR test or the antigen test, et cetera, they're detecting not the antibody, but the actual, the evidence of the virus, right? So there's lots of different tests. There's a lot of confusion around the tests. So I think that you have to be careful getting an antibody test and why are you trying to get it? If you're trying to establish I'm safe, that may or may not be true. Fortunately, it does not appear that at least in the early period, in the matter of the first 6 months or so, that people are very likely to get the infection a second time. However, we have established that people have been infected with COVID-19 more than once. So there probably are about now 10 well-published cases of second infections with COVID-19. That's 10 cases amongst the many millions, right? Obviously, we don't detect every time that happens, but it doesn't happen very frequently. So just be careful that why are you getting the antibody test? So if you had an illness that was very characteristic of COVID-19, and then subsequently you have an antibody test that's positive, then yes, that's believable. But as a routine thing, that is probably not something to do.
Yes, jazakumullah khair. And I would say again, antibody tests only tell you if you may or may not have had the disease, and it can be confused by other coronaviruses, like Dr. Omer said. And so it's always good to speak to your doctor, particularly an infectious disease expert or a lung doctor, before you even embark upon getting this test and spending the money for that. The final question that we have that several people have asked is, I know we've cautiously opened up masajid, and we all miss coming to the masajid and praying in and having that sense of ukhuwah and brotherhood and sisterhood in the masjid. And the question is, with these case numbers going up, people are asking, is it safe to keep the masajid open with precautions? And I'll let both of you answer, inshallah.
So, Brother Imad, let me go on this one and I'll let you come in. I think it is important to realize this question has spiritual and medical scientific dimension, right? Establishing daily prayers in a community is the obligation, collective obligation of the community. So the input of our scholars, as well as healthcare specialists and the law of the land, as dictated by the county and state law, will be taken into account as has been done so far. And I commend the leadership to follow those collective input in order to make a decision. I visit the masjid twice, alhamdulillah, a day, and my day is incomplete without the visit the mosque. And I would say that that's the last thing I want to say go, but at the same time, safety needs to be taken into account. What I have seen in Memphis Islamic Center, brothers are following very good adherence to distancing, masking, bringing their prayer rug, and leaving the prayer hall soon after the prayer and the khatira, which is very short anyway. And our scholars are reminding everyone to also follow the social guidelines for COVID transmission. And my final point is that this decision is not in the hand of the doctors. This decision falls into scholars, physicians, scientists, and state and local regulations. If the state laws say you cannot have a congregation for more than 50, we follow that, right? And the leadership of the masjid, leadership of the Islamic Center will take into account all these factors, right? And I wish and I pray that we'll continue to be able to go to masjid and keep safety. Ventilation, I'll tell to the leadership, please look at your air conditioning, air exchanges. Consider increasing the air exchanges in the facilities of East Masjid. We have brothers in the community who are willing to help in renovating, refurbishing air conditioning unit. Ultraviolet light can be added to the circuit. All of these precautions can be added, but inshallah, with wisdom, with precaution, we can continue to pray as long as the local law allows it. So, Brother Imad, take it.
Yeah, not much to add to that. I think that you covered it very well. I think that mashallah, our masajid have done a very good job in trying to ensure the safety of our families and our everyone. And I think they've made some very good recommendations about trying to certainly avoid going to the mosque if you are ill, if you have family members that are ill, if you yourself are somebody who has a weakened immune system or are elderly, etc. Those things might provide more risk to you if you are going to the masajid. So there's that. When the weather was nice, it was possible to have some of the prayers outdoors and pray in Jama'ah, but as it gets colder, that may not be possible. That is not going to be as safe as praying outdoors. That is a fact. There will reach a time where, if we have enough disease in the community, that the local authorities will tell us that we are not able to have congregational prayers. That hasn't happened yet. And so, in the past, when we were not doing this, that we held off, the community later said that was not the thing to do. And, so we don't know. Right now, the way this surge is going, it may very well be that we will get guidance from the local authorities. And then, as Muslims, we have to follow that. So I think that just all the comments that we made before about other activities that you do, obviously the importance of prayer and praying in congregation is there, right? You said you have to go to the grocery store. That's a necessity. Well, for us, praying is also necessary, but our shayukh have, instructed us about that. And certainly our religion gives us guidance about that. And so they will be helping us guide through that. They will ask Dr. Zaman and me and other experts in the field about what precautions we need to take. And I think early on, Dr. Zaman was there. Mashallah, we have very enlightened religious leaders in our community, and they asked many different doctors to get together and make recommendations, and then that's why they closed the congregational prayers. Inshallah, that kind of thing will continue. So, we'll see.
Shan, there's one piece of fact that could just give you an idea. All of us talk about R0, right? Infectivity rate is now 1.3. And the Shelby County has said if it's 1.4 and higher, it will impose more regulations. So it's very close now, but that's decision we already covered. Thank you.
Jazakumullah khair. I'm going to ask if either of you have any closing remarks. If not, then I will conclude, inshallah.
Well, I just want to mention that this whole goal of this, and may Allah reward everyone participating, Brother Imad, Shan, Brother Light, Hasnain, everybody from IC leadership and the scholars who have been asking us to hold these. The goal to give you kind of a personalized perspective of our assessment of the situation in the Muslim community. You can turn on any hour of the 24-hour into the mainstream media, and you can get more information, more visual, more colorful. Is there, and we encourage you to learn what's going on, keep up with it. But our goal was to give you a personalized perspective of what we see, and that perspective was, please be aware that this infection is not going away for another 6 to 9 months. I say 6 to 9 months for the vaccine to take effect, and our goal is to stay safe, keep yourself, keep your family, your near dear ones, your neighbors, your brothers in faith. Keep them in mind when you go out, because as Shan said, you could be risking others and you're not thinking about it, right? So do safety. We are not saying cancel all the holidays. We're not saying completely give up on any communal event. Children are up for 9 days for Thanksgiving, 18 days for end of the year holiday break. Children are children. Provide them an outlet, provide them an opportunity, be creative. If the weather is good, take them out to Shelby Farms, to the walking trail, jogging trail, work on your backyard, put a barbecue, put something like a basketball or a volleyball court, something like that. Please recognize the need of the children. I want to bring that. They are not going to be able to understand how we understand, but safety is first, but ask Allah to protect us, because tragedy is everywhere, and be cognizant. Be aware of what's going on to others, because mercy comes when you are merciful to others. Allah will shower mercy and protection to you if you are showing concern, compassion, care for others. Inshallah, jazakallah khair.
Jazakallah khair. Let me just make one comment, and I'll just share with you another story. I had shared with you a story before, and I'll share with you a story of a patient. So this patient has some health problems. Her immune system's weak from cancer. And she was being very careful, and she was not going anywhere. She was not going to the store. She was not taking visitors. So she felt that she was pretty safe. And she has an elderly mother who lives in another state, 87 years old. And she was very fearful that she's not going to be able to see her mother much longer, and that she hasn't seen her in 8 months, 9 months. She wanted to visit her mother. So she made plans to travel and see her mother, and she hadn't been taking any visitors. She felt she was completely safe. And her sister wanted to be with the family too. And when she heard that, that her sister was coming and that her mom would also be there, she hadn't seen them in a year, she decided she would come. And to be extra safe, she tested herself. This is someone who is an essential worker. And she got tested because she was around people, etc. And her test was negative. So she thought, great, I can go visit and I will see my sister and my elderly mother. And they had a visit, and they all went home after the visit. And the next day, the sister who had tested negative started having symptoms of COVID-19. And unfortunately, both the woman with cancer and her elderly mother both got COVID. It's a terrible thing. And it just goes to show you that, we want to protect our loved ones. And so sometimes the best protection is you don't see them. You can visit with them on Zoom, like we are doing right now. You can call them, etc. But getting together with your family can have consequences and risks. And we are moving. Another reason to have this meeting that we are having now at this time is because we are getting into a dangerous period where there's lots of holidays, where children are off from school, where people are off from work, where you haven't seen family, and every year, this is the time of year that you visit them. This year, maybe it should be different, and because there is risk, and even if you get tested, there may be risk. So just be aware of that. use all the precautions that you can. If you get together, wear a mask. Be 6 feet apart. If you can be outdoors, that's better than being indoors. If you can avoid altogether that visit and put it off for a bit longer, it is better. Because you don't know who you've been around. Dr. Zaman just mentioned what the R naught is. That just tells you how much illness there is in the community in some ways. So I think just be very cautious at this time.
And with that, inshallah, we'll conclude. Jazakumullah khair to both Dr. Imad Omer and Dr. Muhammad Zaman for their expertise and their thoughts. We ask Allah subhanahu wa ta'ala to keep them and all of our healthcare and essential workers safe from this COVID-19, from fatigue. And we ask Him to grant us patience to get through this illness, this wabah, this ta'un, this plague. And we remembered the hadith of the Prophet ﷺ, where he said, those of you, if you find yourself in the time of a plague, if you get through this, sabiran wa rabitan, with patience and perseverance, your reward will be immense, like that of the shaheed. And he also said that if you die from this plague, then your reward will be that of a shaheed as well. And so we ask Allah subhanahu wa ta'ala to help us and protect us and keep our providers safe and our families safe, and to keep us safe and strong on Iman and on the straight path, and to deal with this in patience. God bless you, and may Allah subhanahu wa ta'ala keep us all safe and reunite us again in happier times. Wa akhiru da'wana anil hamdulillahi rabbil alameen.
Assalamu alaikum warahmatullahi wabarakatuh.